We'll be looking at the various obstructive uropathy of the urinary system, and this is us just trying to look at urine obstruction, okay, like obstruction to urine flow in the urinary system. And obstruction to urine flow in the urinary system can occur at any region in the urinary system, okay? So once you know the anatomy of the urinary system, this should be easy for you, okay? Once I'm saying um, the prostate, you know that the prostate is found only in males, okay? Once I'm talking about the ureter, once I'm talking about the ureter and all that, okay? You guys should be reasoning out with me. So obstruction uropathy of urinary system. This is just like an overview class on it, okay? Obstructive obstructive uropathy. This is basically what the urinary system is made of, okay? Down to the external genitalia, okay? So just trying to say that there could be obstruction to the flow of urine at any point in time of um, this renal system, okay? Starting from the kidney down to the external genitalia. In the kidney, we could have kidney stones, okay? In the ureter, we could have ureteric strictures, okay? At any length. In the ureteral, we could have some ureteral strictures and the rest of them. The obstructive uropathy is a disorder of the urinary system or tract that occurs due to what? An obstructed urine flow and can be either structural or functional. Okay, so now the backup of urine into the unilateral or bilateral kidneys, depending on the location of obstruction, causes what? Hydronephrosis. Basically, the kidneys will what? Enlarge. If there's any obstruction of what? Urine flow, so the urine will now be stuck down here, and much more urine is being produced, so the kidneys will now enlarge. Do you understand? So causes of obstructive uropathy, just like I told you guys, be due to what? Enlarged prostate. Okay, so it could be that your prostate is now enlarged, mostly in men, because the prostate is not found in women. So mostly in men who are 45 years and above. Okay, some people say 50 years and above. All right, you have a benign prostatic hypertrophy, like your prostate will just start naturally just start enlarging and all that. All right, so it could be due to what? Kidney stones. It could be due to what? Ureteral strictures. Okay, it could be due to what? Uterine cancers, and this is like in women. Okay, so if you have ureteral strictures, there's ureter, so there should be what? Ureter strictures too. Okay, so obstruction uropathy, so that obstruction to the flow of urine can occur anywhere from the renal pelvis to the what? Urethra. Okay, so now the development of renal insufficiency in patients without intrinsic renal diseases require what? Bilateral obstruction. Okay, so if there's renal insufficiency, if there's reduction in the amount of urine that is being formed in the body, that is greatly actually linked to this bilateral obstruction. Okay, it could be bilateral obstruction, it could be or it could be unilateral obstruction with a single functioning kidney. All right, and these are basically some reasons why some patients in the hospital can have scanty urine. Okay, so now it is most commonly due to what? Prostatic disease, that's hyperplasia or cancer, or some metastatic cancer. Okay, the time course for obstructive uropathy could be what? Acute or chronic. Okay, so guys, that's it about this obstructive uropathy, talking about the causes and basically the definition and the presentation. The presentation is just simple. The patient will actually have a scanty urine. Okay, scanty urine formation is basically the um, most is basically like the outcome or presentation of this disease problem of the renal system. Okay, guys, that's it about obstructive uropathy. Don't forget, we'll be taking videos on each of those obstructive uropathy, just like I always do. I always break down things because I'm a student who don't really like long stuff, don't really like long lessons. So I have a YouTube channel and I must do the short stuff that I actually like in class. All right, so that's it about obstructive uropathy of urinary system. See you guys pretty soon.